And is it true, Doc, that even if you do survive COVID-19, the damage to your lungs is so great that you probably need a lung transplant?
So I think that's a bit of scare tactics. Or not scare tactics, but scary type of information that puts into social media. So let's just take a step back once again. Most people who get infected with this virus, or almost half, are asymptomatic, so they won't have any long symptoms, right? Then the rest of the majority of people who get it will get it very mildly, right? So it doesn't go into the lungs. It will sit in terms of the nasal cavities, it will affect your taste and smell, which may linger on a bit, but it won't go into the lungs. The people who get to this very, very small percentage who get admitted into hospital and then go into ICU, which is once again a much smaller percentage, they may have ongoing lung issues in terms of affecting their lung capacity. But the short answer on that is where we actually don't know in terms of will those individuals eventually need a lung transplant, or is it just, and this is probably the correct answer, they'll just have reduced lung capacity going forward. For how long we can't be so sure. So on the one hand, I'd like to say it's so early on once again in this pandemic. It is very hard to say in 5 years time what the long-term effects are going to be. However, what we are seeing on the other hand is that such a small percentage of people get severe effects that probably most people will not have long-term effects, and those who do land up in your hospitals and ICUs may have some type of lung functional capacity effect. But in the general word out into the population should be that there's no reason for panic or hysteria in terms of the COVID-19. Once again, as I said, everyone should do what's correct to protect themselves. And if they do land up getting an infection, it's not a death sentence. It's well managed. In most people, it will be easily managed at home. They will pass their 14-week-a-day period, and then they'll be able to, once they clear an asymptomatic, go out into the population again.
And also, Doc, there have been claims that COVID-19 might actually be airborne. What is your take on this?
So you are correct. The World Health Organization, in fact, just this week adjusted their documentation to say that there is a risk of airborne infection. But what we should know is that currently the majority of the large majority of the way that this virus can be transmitted is by droplet spread from an individual to an individual. So, for example, I'm close to you, I'm not wearing my mask, I sneeze, I talk, whatever, droplets from my respiratory system get inhaled by your respiratory system and you pick up the infection. Then there's much less in terms of percentages way of getting the virus. There's been a lot of written about surfaces, that surfaces should be clean, and certainly viruses in close proximity. If you're close to someone and some of that virus or the droplets fall onto surfaces for a short period of time, if you get enough of that virus in yourself, you could get infected. The third methodology, and that's what you spoke about now, is airborne spread. And what there we mean is that if you just exhale the virus into the atmosphere and you're in a room or in a closed office space that it's circulating, there is a risk or potential if you get high enough viral load in your system. And I want to emphasize that. So there needs to be a significant amount of viral load in a specific space for you to inhale the virus and to be infected with that. Once again, if you're wearing a mask, if you're constantly washing your hands, and you're in well-ventilated spaces, that risk should be extremely small. And whilst it is in the news, the biggest way of spreading, and in our mind should still exist, is that person-to-person contact spread is by far the biggest risk, and that is what we should be looking to avoid. Not to be panicked about the airborne spread, and not to be panicked about the surface spread. Just put the correct mitigations in place, wear your mask, clean your surfaces, be in well-ventilated spaces, and in that way we should be able to protect ourselves.
And doctor, can you get COVID-19 more than once?
So there's a lot of literature written on this. The current the current literature and the way general viruses work is that if you get a severe infection of this coronavirus, and it's severe enough that you have symptoms and you've had significantly enough load, you will develop antibodies. Now, we should know that around the world, they're only starting antibody testing now. So there's going to be a lot learned as we go on. And hopefully in the next few weeks, we'll be testing with antibodies. If you remember earlier on in our discussion, I said if you get infected, we're actually looking for the virus. Now what we're talking about is that, are you immunized about in terms of getting infection in the future? So if you've had a significantly large enough viral load, you are infected, you have a proper infection, then the large majority of those individuals will develop antibodies. And those antibodies, by current literature, should prevent you from getting further infections in the next, what we say, around certainly the next three-month period. Okay. However, having said that, we actually don't know, because, as I said, we're only starting antibody tests, and there's still a lot of research. So what the scientific and medical community are recommending, and this is really the take-home message for the viewers, is that even if you've had a COVID-19 infection, you've been significantly infected, you were positive, you're now negative, you're back in the community, you should still take the same mitigation steps in terms of preventing yourself from getting the virus again, and that masking, hand washing, and social distancing, because there could be a risk of you potentially getting it again, but the chances are not, but there could be a risk. So we still recommend to individuals, even if they've had the infection, they shouldn't just go out there and say, I've had the infection, I don't have to worry, and I'm immune. It's too early to actually answer that question. They should still take the correct mitigations and steps in place to prevent possible further infection. Once again, what I do want to add on to this is that hopefully down the line, and that's what we know where the research is going, the real way to get rid of the virus, the most effective way would be to develop a vaccine. And by developing a vaccine, it means that then we would actually get everyone to build up antibodies so they can build up immunity to fight the virus. But until we're at that point, people are going to be infected, they will develop some immunity, and we'll have to see if that actually helps them over a period